Hypothyroidism TSH levels. Hypothyroidism TSH levels is an important topic to consider when diagnosing and treating hypothyroidism. Thyroid-stimulating hormone, TSH, plays a vital role in the body's production of the thyroid hormones, triiodothyronine, T3, and thyroxine, T4. As such, understanding TSH levels is key to managing hypothyroidism. What is hypothyroidism? Underactive thyroid? Hypothyroidism is a condition in which the body's thyroid gland doesn't produce enough of the hormones needed for proper functioning. This can lead to symptoms such as fatigue, weight gain, depression, hair loss, memory problems, and more. TSH, thyroid-stimulating hormone, levels are often an indicator of hypothyroidism and need to be monitored regularly to ensure that the treatment is working correctly. Causes of hypothyroidism. Hypothyroidism is a condition that arises when the thyroid gland fails to produce enough of the hormones thyroxine and triiodothyronine. The most common cause of hypothyroidism is Hashimoto's disease, an autoimmune disorder where your immune system attacks your thyroid tissue. This leads to inflammation in the thyroid, which gradually destroys its ability to produce hormones. Diagnosing hypothyroidism. When diagnosing hypothyroidism, doctors look at both TSH levels and other factors such as symptoms and physical examination results. Depending on what other signs are present in addition to elevated TSH levels, a doctor may also order additional testing such as blood work or imaging studies to confirm their diagnosis. Treatment for hypothyroidism. The main treatment for hypothyroidism is taking synthetic thyroid hormones, also known as TSH or thyroxine, to replace what your body would naturally produce. The dosage should be determined by a doctor based on your individual needs, such as age, weight, and other factors that may affect the amount of medicine needed for effective treatment. In addition to medications, eating a balanced diet with foods rich in iodine can help maintain normal thyroid levels as well. What are TSH low levels means? The TSH level in a healthy individual should be between 0.4 and 4 millunits per liter, U/L. If it falls outside of this range, it could indicate an imbalance in hormone production. High levels of TSH can mean that the body is having difficulty regulating its own hormones and may need help from medication or dietary adjustments. Normal TSH levels for hypothyroidism. Normal TSH levels for hypothyroidism are important to understand in order to accurately diagnose and treat the condition. If you have hypothyroidism, your doctor will typically measure your TSH levels, or thyrotropin, as a way of assessing if your thyroid is functioning normally. Generally speaking, a healthy adult's TSH level should be between 0.4 and 4 milli-international units per liter, mu/L. If your numbers fall outside this range, then you may have an underlying problem with your thyroid gland function and further diagnosis may be needed by a doctor. Conclusion. Hypothyroidism is a condition that affects millions of Americans, and it can have serious consequences for an individual's health. Treatment typically focuses on managing TSH levels, the hormone produced by the thyroid gland to regulate metabolic processes in the body. Understanding what hypothyroidism TSH levels are and how they can be managed is key to gaining control of this condition.